The concept of food as medicine is an ancient one that spans the entire globe and almost every culture. I remember as a child growing up as an immigrant in the United States, our own cultural heritage, where my parents would use food as medicine as the primary means of healing and also to keep us healthy. My mom would give me a spoonful of honey when I had a cough, or spearmint tea when I had an upset stomach. As I started to have an interest in medicine, I wondered whether or not these age-old concepts could be applied to the modern diseases of our time. In my training and residency, where I worked in the hospital, I took care of many patients with heart attacks and strokes and complications from chronic diseases like diabetes, cancer, and obesity. I recognize how we're so good at taking care of people when they're acutely ill and stabilizing them. For the most part, we focus on medications or surgery, with very little emphasis on nutrition, prevention, or lifestyle changes. The thing is, when I took care of that patient who was 55 with a heart attack, that heart attack didn't start that day, that week, that month, or even that year. It actually started back when that person was 20 years old. So I wondered, was this the best approach for these chronic diseases? Chronic diseases are the leading cause of premature preventable death and disease in the entire world. In the United States, we have the dubious distinction of leading the world in chronic disease, where 6 out of every 10 Americans has one of these chronic conditions. These conditions account for 7 out of every 10 deaths and over 90% of the $4.3 trillion we spend on healthcare every year. These conditions are both deadly and costly. This is quite a bleak prospect if we think about the fact that more than half of the people in this audience today have or will have one of these chronic conditions. It's even more bleak if we think that we are fated to have them, that we're fated to get sick just because these diseases run in our family. So, are chronic diseases inevitable? The answer is no. They are not inevitable. They are in fact preventable. Chronic diseases like type 2 diabetes and heart disease can be prevented by how we live our life, which is much more important than the genes we inherit from our biological parents. And the most important choice that we can make is what we choose to eat. I'm going to show you why what we eat matters and how we can use food as medicine to prevent, treat, and even reverse the chronic diseases of our time. Did you know that diet is the number one risk factor for preventable disease and death worldwide? More so than any other risk factor, including well-known risks like tobacco. What we are eating is actually making us sick. In the United States, the standard American diet is sad. And the reason why the sad is so sad is because it is high in the things that are making us sick and low in the things that can keep us healthy. It is high in excess sugar and low in fiber, which leads to type 2 diabetes and obesity. It is high in excess sodium, which raises our blood pressure and increases our risk for heart disease. It is high in unhealthy processed fats like seed oils and chemical additives that cause chronic inflammation and chronic disease. It is high in processed foods and processed meats that increase our risk for cancer. It's low in plant foods, which are a main source of antioxidants to keep us healthy, and also the main source of fiber, which is the main food of the microbiome, which we now know that is critical to our health and longevity. The reason why most of us eat the sad is because our tax dollars subsidize cash commodity crops that make unhealthy processed foods cheap and widely available. The healthy choice becomes even more difficult when we're food insecure and faced with budgetary limitations on what we can eat. It's as if the easy default path, the yellow brick road that we all walk on every day, is the one that leads to disease. That's very different than the yellow brick road or easy path in the blue zones, where people live healthier for longer because they have access to social connections, meaning and purpose, moving naturally, and real nutrient-dense food easily. The food industry manufactures processed foods that are actually making us sick. These foods are full of flavors, but not with nutrients. To understand this better, we need to look at animals in the wild. Animals have cravings just like we do. When they satisfy those cravings, they don't have any knowledge of nutrition or medicine, but they are satisfying them with real foods. And those real foods are always connected with a nutrient. Think of an orange with that tart taste that has the nutrient of vitamin C. As early as the 1960s, the food industry began separating flavors from nutrients. And when they did this, they created thousands of flavors that were empty calories without nutrients. And this created an endless cycle where we would crave things like a chip that has a bean flavor, tomato flavor, where our body really needed the protein and the fiber from the bean and the antioxidants from the tomato, but in fact, we're just getting empty calories. So this endless cycle is addictive. I call these foods frankenfoods. And over 70% of the standard American diet consists of these non-foods. We've been taught by the food industry to believe that they're really food, but they're not. They're masquerading as food. In fact, the high sodium, the high sugar, low fiber, and all these flavors very much have been constructed and engineered just like tobacco products have been constructed by the tobacco industry as nicotine delivery devices to addict us. The good news is that we can actually retrain and change our palates and our taste buds in as little as 28 days with real food. What happens in those 28 days with real food is we actually can turn off disease-causing genes, turn on genes that can keep us healthy. A recent twin study actually showed that a plant-based diet for 8 weeks alone increased telomere length, which is a marker of longevity and aging. One of the most exciting elements of recognizing the fact that we are what we eat after all is that we can use food as medicine. I remember one of my first patients that I used food as medicine with. Let's say his name was Miguel. Miguel came to me as a typical guy who hadn't seen a doctor in over 10 years. We found out that he had undiagnosed type 2 diabetes with a hemoglobin A1C of 11. That's equivalent to an average blood sugar of 300, where normal is less than 100. Like many of us, Miguel ate a standard American diet. So we talked about how food is medicine. Miguel was motivated because his own father had died at 55 from a heart attack, had also had diabetes. And at 45, Miguel was motivated to make changes. So I gave him a food prescription, no frankenfoods, lots of healthy plants, and I started to use the cravings that he had to replace them with real food versions. So for example, sugary cravings, instead of sugary products, we had fresh berries. And I also had him check his blood sugar very routinely every day to see those connections. As he made those connections, we started to see his blood sugar go down. Within weeks, it kept going down. And at 3 months, his A1C came all the way down to 5.9, which is now in the pre-diabetes range. So we had used food as medicine to reverse his type 2 diabetes. I've had the privilege of seeing this in hundreds of other patients. The thing is, physicians do not learn the value and importance of food as medicine. But all physicians need to be empowered with the skills to treat patients just like Miguel. Because we don't learn this, when we look in our medical education, it's not set up for us in that way. Even though diet is the number one risk factor for the diseases of our time, physicians get a mere 19 hours of nutrition education across all 4 years of medical school. That's a huge disconnect. One way to fix this is to begin looking at fields like culinary medicine, where we bring in the evidence-based approach to the art of cooking and the science of medicine and nutrition. The teaching kitchen becomes the laboratory where students learn how to cook and prepare healthy meals and then pass that on to their patients. Once they do this, they can counsel on nutrition. So we can get beyond the statistics where 2/3 of every doctor's visits result in a prescription medication, and where 60% of us are on some prescription drug. We can start to actually subsidize and pay for food as medicine interventions. The thing is, chronic disease is not inevitable. Getting old may be inevitable, but getting sick is not. We have that power in our hands to change as a society the yellow brick road where the path leads to getting sick or the path can lead to being healthy. As a society, we can change food policy and fix our broken food system to make real nutrient-dense accessible to everyone. We can hold the food industry accountable, just like public health officials held the tobacco industry accountable. We can, as physicians, begin to treat people with food as medicine. Health insurance can pay for food as medicine interventions like medically tailored meals and produce prescriptions, where you can actually go to the grocery store and the FAR pharmacy to get the foods that you need to heal you. And as individuals, we have the greatest power in our own hands. We, with real food, can experience what people like Miguel experienced. We can fix our bodies, we can heal ourselves, and we can change our path one bite at a time.